Hi everybody, I'm Louix Dor Dempriey. Today is the 21st of March 2020 and we're in the middle of this worldwide pandemic right now with coronavirus, COVID-19, and I'm here with my biological family in Boston, who are somewhat stranded at the moment, but here on a visit nonetheless. And I've been getting a lot of requests from students and friends all over the world for me to do a discourse on this because there's so much misinformation, there's so much panic and fear. And so I happily agreed to take time out. So please forgive the home movie. I'm not in California. I don't have the studio and the recording equipment or the recording team, but this suits the purpose. As you see, many television shows are doing the same thing, people taping from home. So anyway, we get the job done nonetheless. So the purpose and the modus operandi of why I'm doing this is to illuminate and empower everybody about this and to help allay and displace fears and panic, which aren't really helping anyone or anything. So hopefully by the end of this, you will know a lot more and have more centeredness, groundedness, focus, and have a plan of action for yourself according to what you feel is best. So because most people have a very short attention span, I'm going to cover in the beginning the things that are the most immediate needs of what's going on and what people need to do right now. And then I will continue to expand into some things that have never been spoken before, some illuminating things from the causal plane and in the realms of consciousness in terms of true origin of and underpinnings of this. So my invitation is that you all stay to the end. I haven't timed it. I'm just running off the cuff here. So as it came to me, but hopefully it'll be maybe 10 minutes or so, but please stay to the end if you can. So now, in terms of covering this subject, my intention is threefold. It's to clarify, to give perspective, and to give some protocols. So again, most immediate needs first. In terms of protocols, first we have the behavioral protocols. And most of the stuff that's been going around now has now come into harmony with different states, countries. They're all adopting the same protocols. And those I am in agreement with. But again, I want to clarify because there are people who contradict each other. So the safest and best protocols are, of course, social distancing, which is a term they've come up with. This virus, like most respiratory illnesses, are carried through moisture in the breath. So coughing and sneezing, yes, is the most profound and pronounced way to spread, but it's also in your breath because your breath is air which carries moisture. So the social distancing, when you're talking to people, you want to be a little bit or a lot further away than you normally are. Don't be talking to people from 6 inches, a foot away, back up 3 or 4 feet, and even maybe turn your head a little slightly so that you're not breathing and talking face to face. That does wonders. And also obviously exchanging of fluids too as best you can. And then the not touching of the face is critically important because again, you have direct contact through your mucous membrane, so eyes, nose, and mouth. A lot of the experts now, and I agree with them, are saying that, just don't get too caught up in the masks and the rubber gloves. The masks do help to a degree, but they're not the most critical. The distancing, not touching your face, and frequent hand washing. When I come in from the supermarket or from running an errand for my mom, who I'm helping to take care of, I immediately wash my hands. I see people wearing gloves and then they don't realize that they've touched their door handles or their doorknobs or railings a million times. So the gloves might help you in a moment, but the gloves are not really the issue. Frequent washing of hands every time you're touching things that are common area things, not only in your home, but especially out in public. So not touching the face, hand washing, and distancing, those are critical. And so those parts I'm in total support of. And again, going into panic and fear is not the answer here. There's a mass ignorance that's going around now that, if we just hunker down, there are isolations and quarantines happening worldwide right now, and they're going to increase and they're going to get more severe. But there's an ignorance that's being born from within that in 2 or 3 weeks we'll be fine and we'll get past this. It's a virus. It's a type of flu. It's here. It's likely permanent. Can't say for sure, but likely, like the flu we get every year, and it will likely come in waves. Now, one of the things that is most dangerous is that because it's brand new, the human species as an animal has not developed antibodies. Obviously, the medical model has not developed a vaccine. And another factor, which is even larger, is that the mortality rate in this one, and partially for those reasons, and other reasons as well, is much, much higher. The common flus have a mortality rate less than 1%, and this mortality rate is averaging 3 to even higher percent. And with elderly and heavily immune compromised people, it's getting up as high as 10 to 13%. So those factors are what make it scary, not that it exists, but we have no vaccine, no built up antibodies and immunities within the human race, and a much higher mortality rate. But keep in mind that it is a virus that's now in the collective on Earth. So it's all these things can't just go away when the quarantines stop and the lockdowns stop. It's not like, okay, back to business as usual. These protocols in these 3 categories we just listed, these protocols are what prevent you from getting any respiratory illness. And these are part of what keep you healthy in general. So the hope is that people will raise the bar, so to speak, on their habits to keep healthier. Now, again, there are 2 aspects of not getting this. One is these social protocols and hygiene protocols. But again, those are one aspect of prevention, and that is avoidance. The other one, that's external. There's an internal aspect as well, and that comes through strengthening your immune system through improved nutrition, eating a lot of fruits and vegetables, organic if possible, because pesticides and antibiotics and all the garbage they put, chemicals, preservatives they put in a lot of foods is very toxic to the human body. So, and if you don't have organic, I don't believe in it, whatever. Organic if possible, but the key is having a lot of fresh fruits and vegetables, reducing garbage foods, fried foods, candy, refined sugars, junk foods like that, getting healthier food in you. Critical is to alkalize your body. For those who don't understand that, and again, any of these subjects could be an hour-long discourse on their own. I know I'm talking fast, but I'm trying to get it all in a short video. Disease and illness can only grow in an acidic environment in your ecosystem. That's what harbors them and what fertilizes them, so to speak. So you want to alkalize your body because that strengthens your immune system and makes it a very inhospitable environment for illness of all types, including cancers and colds and all types of illness. So again, fresh fruits and vegetables help in that, especially the leafy greens, really strong. Some super powerful healing tonics and foods that do a tremendous and very fast alkalizing of your body are the fermented foods, such as kombucha tea, if people make or buy kombucha. One of the best on the entire planet is raw, unfiltered, organic apple cider vinegar is one of the best. Lemon water, now I don't mean lemonade that has sugar in it and usually refined sugar. Squirting a lemon in a glass of water, and if you want to make a lemon tea, you could squirt a lemon in to some boiling water and cut a few slices of lemon, drop them in too, and let that soak. Lemon alkalizes the body so powerfully. Let's see, another thing would be to increase superfoods and special supplements. There are, powdered greens you can buy in health food stores and supermarkets, the super greens that have, components of 30 to 50 ingredients. I take them every day and advocate all those who study with me to take them. They detox, purify your body, strengthen your immune system, and help ward off bacteria, virus, all types of infection and disease. Seaweeds are loaded with minerals, and a lot of the super greens have seaweeds in them. alfalfa, barley grass, wheatgrass, spirulina, chlorella, the single-cell blue-green algae, and a lot of other, I mean, I could go on and on and on. But getting some of those super greens is a supplement as well. Increasing your vitamin C. Vitamin C is a great nutrient to stave off infection and illness. One of the highest sources of vitamin C on the planet is camu, which is a fruit, I believe, and also moringa powder. Moringa is the ground up leaf of the moringa tree, and it has 75 times the vitamin C of oranges. It's a superfood. It has about 60 or 75 nutrients in it. And you can buy it in tea form in health food stores. You can buy it in powdered form. I have both. Superfood, very powerful healer. So these things help detox your body, strengthen your immune system, alkalize your body, and that will stave off infection because the quarantine will end and the social distancing will fade somewhat. People are still going to date and have sex and hug each other, and friends get together and families. So the internal part of becoming healthy is even more important. Now, in terms of, when the quarantine's over, the hygiene, hopefully more of that will stick. Be more mindful of touching your eyes, nose, and mouth all the time, not just in the COVID era. And frequent washing of hands. If you're out in a shopping mall that has 10,000 people from every walk of life, it would make sense to wash your hands when you get home rather than just go start eating a meal. So hopefully this is creating a heightened sensitivity on hygiene, and hopefully a lot of that sticks. Okay, so these are most immediate needs, but bear in mind it is a flu that's here, probably here for good, and we want some of these protocols to stick in improving your health and hygiene and your social habits. Now, for those of you who are sticking with me, we're going to go a little deeper, a little more esoteric. Now, in terms of the cause or origin, first of all, what everyone is debating and arguing over in terms of cause is actually a false cause. What people are discussing is actually the vehicle, how it spread, not why it's here. So in terms of the three theories, the first one, and still probably the most widely held, that it's originated in the wet markets in China from people eating these live wild animals that are sold. That could very well be. There's another one about chemical warfare being developed. A lot of it's developed in China, not necessarily for the country of China. The US develops a lot of chemical warfare. Many countries do. Is a lot of it made in China? Could be. Not really relevant. There's a far-fetched one. A lot of Trump supporters are saying the Democrats started this to knock him out of office, which is as insane as it is ignorant. Viruses don't attack political parties. They attack the entire human race. So things that are getting silly like that are just, it's kind of pointless. But whatever the origin of where it first appeared is kind of irrelevant now because it's here. It's here, and now we have to deal with it and move forward. Where do we go from here? Now, but as I said, those address the vehicle, how it's spreading, not why. So now we get to the juicy part. Now we go to the why it's here. And that we have to leave the earth plane and go to the causal plane. Everything, the highest plane of creation is thought. Everything originates in thought. The earth plane, the physical plane, is the densest plane of creation and the last place anything shows up. Secondly, everything happens in life, not only my life, your life, everyone's life, for the purpose of your God realization. Translated into simple layman's terms, everything presents itself in your life as an opportunity for growth and expansion, to help you learn and to help you expand into a kinder, more loving, more divine human being. Put it that way, easier way to understand. So we want to see that if this came into the world, why at the causal plane would humanity magnetize this? It's actually the cure for a problem, not the cause of it. I mean, it is a problem because it's affecting people, and I, of course, have great compassion. A lot of people are going to have deaths in their friends and family, so in no way am I being insensitive to it. At the same time, my job in this world is to illuminate and educate. So on the causal plane, why it got magnetized and drawn into creation, it was in response to a problem. And the problem is threefold in this particular case with COVID-19. It's to address three problems that have gone so far out of proportion for so long and have been doing untold damage to many, many people. And those three issues are greed, corruption, and what I've termed disassociation. I'll explain that in a little bit. Now, it's interesting that when I say that this is forcing these issues to be addressed, look at the response or reactions that are now happening. Banks are now have staved off evictions, and foreclosures are on hold. They are giving 90-day notices on 90-day waivers on mortgage payments. Banks historically have been, their corruption has gone way, way out of control with, making from 10, 20, 30% up to 300 and 3,000% off your money and paying you 0.01% on your money. Everyone has the right to make a living, but to give you nothing to borrow and use your money and then they make a fortune off it, it's corrupt. And that's why you've seen the waves of bank failures. It's trying to bring balance. It's not, there just needs to be more balance. So this is a karmic cleansing that's happening here. We have a broken tax structure in this country. It's so corrupt and it's so unfair on so many levels. Now, again, any of these I could do an hour-long discourse on. But now, the tax filing system has been waylaid several months. There are all kinds of waivers and dispensations being given. We have a completely broken medical infrastructure that has now been very clearly exposed. Rather than blaming President Trump for what he got rid of, blaming Obama for what he didn't do, that's silly. The problem needs to be addressed and needs to be fixed. Now it has been coerced. The universe is now coercing this broken system to be fixed. Insurance rates are so exorbitant that no one can afford them. So, the system needs to be fixed, and now it's being coerced to be addressed and fixed. We have a corrupt insurance industry. People can't afford to buy insurance. They can't insure their homes, their lives, their medical insurance. And now they have been inundated with claims. They're going to be inundated with so many claims it's going to break the back of the bank. So the areas of greed and corruption where there's been so much imbalance or impropriety, they're the areas that are getting hardest hit, bearing the financial cost of their own crimes over the years. So there's a karmic cleansing that's happening, but also an invitation to change. And if that change doesn't happen, first we have to address the immediate crisis, and that's help people, save lives, bail people out, of course. And many countries are doing this, the United States included. On a larger scale, though, these problems still have to be addressed and fixed. And if they don't get fixed, if the bailouts just happen and then life goes on, something else will come even bigger and more dramatic. I guarantee you, that's the way the universe works. Whenever you say no to a lesson your soul needs, wants you to have, and delivers to you, the universe, in honor of you, says, oh, you didn't hear it, you didn't see it. I'll send it again and I'll turn up the volume. So maybe this time you'll catch on and you'll get it. So hopefully these things will be addressed, and I know they will. If not now, then at some point. So the third category is disassociation, which is another word could be disconnect. Things have happened. There's been a breakdown in society of a heart connection, of intimacy and heart connection among humanity. We have a broken model of the family unit. When I raised my three kids, they said almost none of their friends had family dinners together. Now, it's not entirely the parents' fault because the divorce rate's higher than the marriage rate. There are a lot of one-parent households. More than 50% of households are one parent, and that parent has to work his or her butt off all day, all night to take care of their kids. But be that as it may, there's been a breakdown of the family unit, and people are just kind of fending for themselves and living like a feral, wild lifestyle. There's been a breakdown in intimacy. Look around at a restaurant and watch people on dates. People aren't even talking to the people they're with. Everyone's on their cell phone. They don't talk to their date. Their families don't talk to each other. They sit everywhere I go. I see it 100% of everywhere I go. There's a disconnect that's happened. Monogamy is no longer fashionable in relationships. I'm a 30-year counselor. It's sad and shocking. It's kind of a way that it goes. So, now the mode is for open relationship. I'm not here to pass judgment on it, nor to give a discourse on it. I'm simply pointing out things, the disconnect and disassociation that's happened. People don't talk to each other anymore. They text only. And they text now, not even in language, in words. They text in acronyms. And if you don't know what they're saying, you have to go to the Urban Dictionary and look up the latest acronyms, because no one will even use a word or proper grammar. So, and even people my age refuse to get on the phone. It's a texting world. People's attention span, the average human attention span is 30 seconds to a minute. That's deplorable. People watch a video for 30 seconds to a minute and turn it off. People look at their texts that come in, and then they just put the phone down and say, I'll deal with them later. People surf the internet for an hour instead of actually looking at something. People surf the television for an hour rather than watching a program. There's a disconnect that's happened. In response, what did the universe send? It sent quarantine. Everyone gets sent home to be with their family. My sister just called me a few minutes ago before I started this taping. She said, I just had to drive to the grocery store and I see couples holding hands walking. She said, I've never seen families are walking. People are out walking their dogs. People are out walking with their family members, having dinner with their kids, all hanging out together. My family's all here around the table. All my brothers and sisters hanging out with my elderly mom, and it's in response to the problem. The COVID has drawn people, forced people back together again to reconnect. And not only that, but to care. So one of the other things that it's coercing, the government can't do all the bailout, not only this government, but any government. This is again part of the cure. My invitation and what I know God and the universe is asking is, and I'm imploring, is I'm asking all of you who are watching this, help each other. Share your food, share your talents, share your strengths, doing chores for each other, especially the elderly, the immune compromised, people, God forbid, who get this virus. Cook for them, go buy their groceries for them, do their errands for them, do chores for them, reconnect with family members. This will accelerate as fast and improve as fast, if not faster, than the government's developments in getting a vaccine and other things they're doing. At the human level, the changes people make within themselves to learn to start caring again, start talking to people on the phone, meet people in person rather than, videotaping and texting when you can, obviously. Share your food, share your money. The government bailout won't solve all the problems. It's huge what they're doing, and it's awesome. It really and truly is awesome. However, it's still not enough, and it won't all be able to come from the government. This has not really hit the news or the media just yet, but most of the help is going to come from people helping people. So if you're in a better financial position, help people who are close to you, family members, dear friends who might miss a bill or two. Reach out and help them pay it. Share your food if you have surplus. My sister saw two housewives in a fist fight at the supermarket last week, and it's not supposed to go that way. Don't buy 10 years supplies worth of foods. Buy what you need, maybe a little extra, but share what you have with other people. Run errands for other people. Watch out for the elderly and the immune compromised. Raise the bar. Like we're raising the bar on hygiene and social habits, we need to raise the bar on the caring and love quotient. Because remember, everything that happens is to help us increase our love quotient to become kinder, more loving human beings. And that's already happening here. It's the cloud that has a silver lining. People are already reaching out and starting to care. So put fears aside. It is tragic. A lot of people will continue to die from it. We will move through it, but remember, it's in the system now. So if you think we can just go back to normal in 3 weeks, that's sheer ignorance. That's not the case. But changes can be made so that fewer people get it, our immunities will get stronger, the vaccine will one day come, and we'll have better habits, and we'll restore some of the broken parts of society, not just in the institutions, but also in human consciousness, so that we emerge a kinder, more giving, more sharing, more loving human race from the depravity to which it has sunk. And I don't mean to say all humanity is depraved. That's not even remotely true. There's so much love everywhere, but there have at the same time been some habits and patterns, societal behavioral patterns that have become abysmal, and they need to change. And this is the beginning of the divine's serious coercion of that change. If not, again, when the universe and God always uses the path of grace. So whenever the path of grace is refused, the kind invitation, pressure and coercion get stronger from the universe to make change. So obviously the fact that something this drastic is happening means that change really, really needs to happen, and immediately, and it is. So, beloveds, that's all I have to say at the moment. I hope this has allayed fears, brought people much calm and equanimity, and sourced you in ways both in the physical plane and in your heart and consciousness. I'm Louis, and something else you can do, if this resonates with you at all, please share it with other people. Text it, email it to people, post it on your Facebook page, your Instagram, wherever. I don't know a lot about social media, but post it, share it wherever you can, so that we can all join together and help make things brighter and better for everyone. And let's keep caring and loving for each other. Thank you so much for your time. Namaste.